Hello, this is Dr. David Tam, President and CEO here at Beebe Healthcare, and today is another Tuesday with Tam special edition, where we sit down with your community practitioners to learn more about the specialized care they provide and a little bit more about themselves as they join Beebe Healthcare or as they have been part of Beebe Healthcare for many years. These next few editions may look a little bit different than what you're used to, though, because we're doing things electronically as we all continue to take precautions with COVID-19. So we're doing this on camera just like we were CNN, rather than if we were all together back at the historic home of Dr. Richard Beebe. Today, we'll be speaking with Dr. Alkhatib, or I'm going to call him Al, or Dr. Alkhatib. He's a pulmonologist who recently joined Beebe Pulmonary Associates as part of Beebe Medical Group and also sees patients in our intensive care unit. So that's a really big job that he has as he's joined us. Dr. Alkhatib received his medical degree from Jordan University of Science and Technology, and he completed his internal medicine residency at St. Elizabeth's Medical Center and Tufts School of Medicine in Boston. So I was talking about the weather, but he reminded me that he came from Boston just recently, so this is nothing compared to what he's used to. He completed his pulmonary and critical care fellowship at Tulane University, though, and he and his wife then moved to our area here in Lewis, where both are physicians with Beebe Medical Group. So Dr. Alkhatib, welcome to Team Beebe.
Thank you. Thank you. I'm happy to be part of the team.
Yeah, we're really glad to have you. And how's been your time in Sussex County so far?
It has been great. If anything, it's even better than we expected. We live in Lewis, and our clinics mainly in Lewis. So it's a small town, but it really has everything you need in your community. So the restaurants here are great. There are so many activities, more in the summer, but there are so many activities to do in the town. And the best thing is being close to the beach. That's a blessing.
Yeah, I know. Boston is one of my favorite cities. So is New Orleans. So you've come from some very big cities, but you're right. Beebe Healthcare in Lewis and Rehoboth, they all have everything that you would really want right here in our part of the United States. So I'm glad that you're enjoying it. I hope your wife is enjoying it too.
She loves it.
Well, what an amazing time, isn't it, for all of us to be working in the healthcare field? Can you do me a favor and tell me, give me a couple thoughts on your reflections of what 2020 was like for you and your family, both, of course, starting as an attending physician and working and, being here, starting in the practice, as well as maybe personally for you and your family.
It's been a challenging year. I think that's also an understatement. I still remember how we started the year. I was done with, the fellowship I did is mainly pulmonary and critical care. The more difficult part is usually the ICU. So I was done by most of my ICU rotations in January. So I thought, you know what, I'm almost done with my training. Then we got hit pretty bad with the COVID. At some point, we had more than 50 COVID patients in our ICU in early April and late March. So that was a complete new experience that we really learned from. One of the things, we learned is basically there are so many things we take for granted in our life, whether in practice or in our personal life, that can really change overnight, and that's what happened with the pandemic. However, we did the transition to Lewis from New Orleans. That was kind of pretty smooth. It was, one of the few good things that happened in 2020, that we moved here, we are part of the team, we are happy to be here.
So, I just didn't realize it, that you were doing critical care fellowship, and as such, there you were at the beginning of the pandemic in your final year as a critical care fellow in the ICU. That must have been a really valuable as well as challenging learning experience for you.
Yeah. I mean, surviving a pandemic was not part of our training before March. So it's definitely it was different experience. And back in April, it was really different because we were learning more about the disease as we are seeing patients coming to our ICU. So that was really difficult part, and you know, we definitely learned a lot from the first few months dealing with COVID.
You know how what a blessing it is for those of us here at Beebe and of course in Lewis and Rehoboth to have somebody who actually was in a large critical care fellowship program learning all about taking care of COVID and respiratory issues, and having that expertise now as we are in the winter surge, if you will, of COVID here in our part of Delaware.
Yeah, definitely. It was part of the experience, and again, there are so many things we know now about COVID that we really didn't know back in April. So I think the care we provide to our patients now is significantly better than what we did when we didn't know so much about the disease earlier.
And I'm assuming that the people here, the nurses here, the staff, the critical care program, that our ICU is able to handle, the COVID-19 patients.
Definitely. I had no concerns. We provided the care that any patient can get anywhere. I mean, everything that can be provided to the sick patients in the ICU anywhere is being provided now at Beebe.
That's great. Now, you said that, I think you said to some people before that you're really proud to serve this community, and that you and your wife both had Beebe on your short list. And, I feel the same way, just having come here in March. But tell me why you and your wife, and what's your wife's name?
My wife, her name is Joanna.
Tell me why you both had us on the short list, and why you were really looking, besides the beach, to come to to our community.
Which is an important part. It wasn't the most significant one, though. So, so my wife she is part of the endocrinology team now at Beebe. We finished fellowship together, and we were looking for our first job together. So I mean, if looking for your first job is challenging, being like you and your spouse looking for a job in the same place is even like 2 times more challenging. So you need to both like the city, you need both to like 2 different practices, because at the end of the day, you can like the pulmonary practice in one place, but then you may have an issue with the endocrinology. And we had this in other places. So we had like to check multiple things on our list, including the city, each practice, and basically the people in every group. And we interviewed in actually many places, and I can tell you basically our common list had one place. It was Beebe.
That's great. I got to ask though, you and I both have come to a new community during the pandemic, and everybody tells me that we have not experienced all the other amazing things that the area has to offer, during the regular year. But what have you and Joanna really enjoyed doing so far here in our community?
So it's been difficult, but mainly like inside like the old town. It's actually, there are so many good places to visit, and also, I mean, we can't ignore the beach. We came here before the summer, so that was perfect timing. Also, if even if there is something you really, for example, there are few things we are looking forward, like going to Broadway. So that's an advantage of being in Lewis. It's really close to some of the biggest cities in the world. So that's something we weren't able to do, but it's in our list, and we are waiting for it to open. But in general, I mean, we stayed local for the most part, and really we are having fun doing just the normal things that we usually do.
It must be so nice to at least be together, live in the same place, have a regular schedule that's not a fellow or a residency schedule, and to enjoy, the things that you can do after your training.
Exactly. That's definitely that was a good thing. And also during the pandemic, I mean, we had more time to spend together. So
Yeah,
that's
that's
definitely,
great.
yeah.
Tell me a little bit about why you became a doctor and why pulmonary medicine. I know that that's an interesting question, but for you, what drives you about pulmonary medicine?
So for people who don't know, like pulmonary, it's one of the subspecialty in internal medicine. So I did my residency in internal medicine, where basically we see patients in the hospital, we see them as an outpatient, and during the residency we do rotate in different services, including the pulmonary and in the ICU. So personally, I did like the pulmonary and critical care because it has the good mix of being inpatient, working with the sick patients who need you the most in the intensive care unit. And at the same time, unfortunately, in the intensive care unit, we see the patients when they are sick, but then we lose contact once they leave the ICU. So that's the advantage of the pulmonary part, where we basically see the patients in the clinic and then continue to follow up with them. So there's that continuity part. So that's basically having this mix of the inpatient and the outpatient clinic was something I definitely liked in pulmonary and critical care.
So before we go, what are some of the diseases or disorders that someone should come and see you? Like for me, pediatric neurology, seizures, right? But what about what do people think? Oh, I have this. I need to go see Dr. Alkhatib.
Yeah, so pulmonary diseases usually include anything related to the lungs. So there is the big group of asthma COPD patients. We manage them in the clinic. There's also interstitial lung disease, which is the area I did most of my research during fellowship. That includes idiopathic pulmonary fibrosis, sarcoidosis, all these interstitial lung disease. And then there is the other part, which is lung nodules or lung masses that need follow-up or need basically diagnosis. We do the procedure, some of the procedures to make the diagnosis there. So these are the main conditions we usually manage in our clinics.
Okay, great. Well, Dr. Alkhatib, thank you so much for taking a few minutes with us today. I know you're super busy because of the ICU and COVID, but just so glad that you joined us here at Team Beebe, and really excited also because of Joanna, and her endocrine is also an area that we're so desperately in need of, and we have 4 now here, so we're really excited about that. So thank you very much for being part of Team Beebe, and thank you so much for joining me today on our Tuesday with Tam.
Thank you so much. It was my pleasure.
And that's all the time that we have today. Thank you, all of you, for joining us on another edition of Tuesdays with Tam, which is always about bringing to you our both current and existing physicians and providers, and then, of course, some of our new exciting physicians and providers that we are bringing to Sussex County as we continue to create the next generation of care. And remember, as we go through the holiday season, please be safe. The 3 W's of washing your hands, wearing your mask, watching your distance. I'd rather have you meet Dr. Alkhatib in clinic or at the Acme or at the Giant or on the beach rather than in the ICU. So please be safe. But remember that if you need care, come to the ER, come to our walk-in clinics, get seen, so that you know that if you do need care, if you need advanced care, there are professionals like Dr. Alkhatib and the others ready to take care of you here at Beebe Healthcare in Sussex County. Thank you so much. Happy holidays, and we'll see you in 2021.